check this out. Be a trained nurse. At least that's what we're aiming for. So we're going to be starting chapter 13, which is drugs for gastrointestinal problems. There we go. It's also not a super long chapter, textbook pages 240 to 264, so please read those. ATI chapters 24 and 25. So we're going to talk about various kinds of drugs that are going to stop you from vomiting, hopefully. Keep your intestines moving the way they're supposed to. We'll talk about antacids. We'll talk about various other drugs to protect you from excess stomach acids. And we are going to talk about laxatives and antidiarrheals. That's always fun. So on page 241, we have a figure that shows the digestive system. And of course, we know the function of the digestive system is to both mechanically and chemically process everything we take in by mouth, absorb all the nutrients that we can get out of them, and then eliminate whatever the body doesn't need. So the main structures we're going to be talking about are the mouth, the esophagus, the stomach, the intestines, small and large, and then we have accessory structures like liver and pancreas, which both have to do with digestion, but not directly. So the digestive system is a system that has all sorts of protective factors built into it. It has to work very well on anything that you take into your mouth, any kind of food or beverage taken into your mouth, and it has to be processed, but the digestive system still has to be gentle enough on itself that it won't digest your stomach. So that's pretty tricky how they're able to do this. And a couple of ways that the body does this is by making a layer of epithelial cells that reproduce very, very quickly and perform a fairly strong layer of tissue. And then we have mucous membranes that, of course, like all mucous membranes, produce mucus, and that also helps form a protective layer on the lining of the GI tract. Now, as we age, we have a lot of changes in our GI tract. There is many times a lessening of blood flow with age. We might change the amount of surface available, especially if we've had any type of GI surgeries at any point during our lives. And motility can be very different in young patients as opposed to our older adult patients. Motility being the movement of the GI tract and the motions that the stomach and the large and small intestine make, or small and large intestine, I guess, make as they are passing the food through the GI tract. And basically it's just one long tract from the mouth to the anus. And if you stretched it all out from beginning to end, it would be really gross. So I always mean to look up how long the digestive tract would be if you laid it out end to end. I'm sure it's this, pretty incredible number. If anyone wants to look that up, that would be awesome. So the first type of drug we're going to talk about are drugs that are considered antiemetic or anti-vertigo. Antiemetic, of course, refers to drugs that keep us from vomiting. Anti-vertigo helps with the dizziness, usually inner ear related, which can lead to an upset of the GI tract and can end in nausea and vomiting, particularly like motion sickness. You're riding in a car, you are riding on an amusement park ride, you're on a cruise ship, and as the body moves, the semicircular canals inside the ear get disturbed. You might get a little dizzy, but you are going to feel it in a sensation of nausea and vomiting in the GI tract. So there are many good drugs that will take care of this. And we start talking about those on page 243 in table 13.1. Sorry for the moving around of the phone as I'm recording. That also could make a person nauseated. All right, so there are a number of factors that can cause nausea and vomiting. Some medications can make you get nauseated. If anybody's ever taken a multivitamin on an empty stomach, you know that it doesn't take long before it can create some uneasiness in the GI tract. There can be various metabolic disorders. For instance, untreated diabetes many times causes nausea and vomiting. The blood sugar going up can cause nausea and vomiting. Radiation, especially to the GI tract area. Motion. Any kind of gastric irritation where you eat something that just does not agree with you. Vestibular neuritis, which takes place inside the inner ear with the nerves, or increases in what we call the CTZ area, chemoreceptor trigger zone, usually having to do with dopamine, or a vomiting center located in the brain that has to do with acetylcholine levels. A disturbance in any of these can create feelings of nausea, vomiting, and perhaps dizziness. So what we do is we come up with different chemical agents to stop or slow down anything that stimulates those vomiting centers. So we use these drugs to both prevent and treat nausea and vomiting that can come about from motion or the GI problems that can occur after surgery, especially if they've been operating on the GI tract. Anesthesia, some anesthesia agents can just naturally cause nausea and vomiting. And then cancer treatments, both chemotherapy and radiation, have been shown to cause nausea and vomiting.